So the history and origin of pharmacognosy. So history of herbal medicine, it is as old as human civilization. Long before the beginning of the Christian era, there were some documents available which are of great antiquity or significance, which revealed that plant material are used as drugs or medicines in various countries like India, China, Egypt, and Greece. That is the reason India, we have got Ayurveda, that is the traditional system of medicine. China, it has got the Chinese system of medicine. 16th century BC, that is before Christ, one of the most surviving remnant, that is called as Papyrus Abbas. Now this Papyrus Abbas, it is a long scroll of 60 feet long and a foot wide. It is a text document and it is dominated by more than 700 different drugs containing 800 formula. So there was a lot of information available in 16 BC. As and when the time progressed, since 5000 BC, many medicinal plants had been used in China as drugs or medicines. In 3000 BC, the oldest known herbal is Penteso, which was written by Shandong. Now, this Penteso, that is a compilation, it was containing 365 drugs, and every day one drug was used by that particular individual, that is Emperor Shandong. Indians also started working meticulously to examine and classify herbs which they came across into groups, and it is called as guna. So the classification of the herbal started taking place in our country in India, and the groups, it is called as the guna. Sage Charkha, he made 50 groups containing 10 herbs, each of which, according to him, would suffice an ordinary physician's need. So he started classifying the herbs in 50 different groups. Like that, 10 herbs he was able to identify. Sage Sushruta, he arranged 760 herbs in 7 distinct sets based on some of their common properties. So Sage Sushruta, he got 7 distinct sets containing 760 herbs, and the compilation information of all these herbs, it is given in the book which is available, that is called as Sushruta Samhita, and the book given by Sage Charkha of 10 herbs of 50 groups each, it is called as Charak Samhita. So these books are available in the market, wherein the information about the herbs or medicinal plants is very well given. Who are the pioneers to pharmacognosy? It started from 460 to 370 BC. Hippocrates, he is regarded as father of medicine. He collected, identified, and used a large number of medicinal plants. In 384 to 322 BC, Aristotle, student of the great philosopher Plato, that is Aristotle, he listed more than 500 plants of medicinal importance with their description and uses. In 370 to 287 BC, Theophrastus, he collected, identified large number of medicinal plants and recorded their medicinal properties. In 1st century AD, Dioscorides, a Greek physician, he published 5 volumes of the book entitled De Materia Medica in 78 AD, which describe more than 600 medicinal plants with their collection, storage, and uses. In 23 to 70 AD, Pliny the Elder, a Greek botanist, he collected and described large number of medicinal plants with their uses or applications. 131 to 200 AD, Galen, a Greek pharmacist, physician, he described the methods of preparing pharmaceutical formulations containing plants and animal drugs. These methods and his other observations on medicinal plants have been recorded in as many as 20 volumes of the books. The present day Galenical preparations or Galenicals are prepared according to his methods. One of the classical examples in his apothecary or compilation is the opium. Opium, it is coming from opium poppy, which contains morphine, codeine, which is a narcotic analgesic. Codeine, it is used as an expectorant. So all this contribution is coming from Galen, which are called as Galenical preparations. 1493 to 1541, Paracelsus, A chemical entrepreneur, he developed mineral salts which might have potential of being used as universal curative agents. 1645 to 1715, Lee Mary, he reported the importance of extraction method, and he used alcohol as an extractant for carrying out extraction of active chemical constituents or phytoconstituents. 1785, William Withering, he published an account of some medicinal properties of foxglove leaves based on 10 years of experimentation. Percolation process was used for fruit drugs. Percolation, over here a percolator is used which is conical in shape, and the plant material is placed, and from the top of the plant material extractant, for example the alcohol, is poured in, so that what will happen, whatever active chemical constituents or phytoconstituents are there, they will get solubilized in the menstruum, that is alcohol, and that particular alcohol, after the solubilization is done, active constituents which gets into the extractant, they are being removed from the bottom of the percolator. Calumba, a bitter tonic, that is an alkaloidal drug, become prominent or official in 1788. So drugs containing bitter tonic, they are tasting bitter, and they are the one which stimulates your appetite or appetizer, and they improve your digestion. In 1803, Derossin, a French pharmacist, he isolated narcotin from opium. Sertiner, he isolated morphine from opium, and he identified its role in alleviating pain. So it was identified that opium can be used as analgesic. There are so many other contributors who identified so many phytoconstituents. Strychnine from Nux vomica, it is used as bitter, stomachic and tonic. Amitin from Ipecacuanha, amitin, it is used as expectorant, anti-amoebic. Brucine from Nux vomica, piperine from Piper longum, quinine from what you can call it as cinchona bark, it is a very good anti-malarial. Colchicine, that is colchicum plant material, it is used in treatment of gout. Stomachic, again, it is for improving your appetite and thereby your digestion. Pelletier, the French pharmacist, he reported isolation of strychnine from Ignatius bean and later from Nux vomica. In 1852, Stats and Otto, they identified the new extraction process for alkaloid. Some other important discoveries during this period: 1828, Fawcett and Riemann, they isolated nicotine from tobacco leaf. Cocaine by Newman in 1860. Then 1875, 1877 and 1887, some other pioneers, Hardy and Gallows, isolated ubin. Ubin, it is used for treatment of myocardial infarction or angina pectoris. Pilocarpine by Gerard and Hardy, it is used for treatment of glaucoma. Nagai, he identified ephedrine from Ephedra gerardiana for treatment of hay fever, anti-asthmatic. Kirsten in 1891, he identified podophylotoxin, which is an anti-cancer drug from Podophyllum. In 20th century, isolation of ergometrin, digoxin from digitalis, it is a cardiotonic. Reserpine, it is antihypertensive tranquilizer. Theophylline, it is a diuretic CNS stimulant. And quinidine, which is an antiarrhythmic drug. These are some of the significant discoveries. 1707 to 1778, Swede Linus, he is a great systematist who classified plants and introduced the system of naming the plants known as the binomial system of classification of plant. 1862 to 1863, Bentham and Hooker. 1883, Eckler. 1887 to 1898, Engler and Prandtl. Plant classification method was developed. G. Mendel, important observations on plant hybrids were published. 1865, Burst, he published Anatomical Atlas of Fruit Drugs. Later in the century, Wall and Tiskrich, he reported anatomical characters of several powder drugs, which is of great significance. So, powder drugs, they are going to contain some powder characteristics like xylem vessels, xylem fibers, phloem fibers, stone cells. 1904, Greenish and Collin, Anatomical Atlas of Powdered Vegetable Drug was compiled.